Hello and welcome to Health Live at Seniors Today. We are delighted to be here with you once again and have with us Dr. Prasanna Shah yet again for our session today. Thank you and welcome to Health Live at Seniors Today. Before we start with you, I must ask our producer to display a screen on our on the window here. Delighted to share with you the latest issue of Seniors Today. As you can see, this is an article where we've spoken about the need for no negativity, no doom scrolling, which is negative news through various media, no anxiety, no loneliness. So that's an essay that we have, plus we have our usual articles. This is the magazine which is just out today. And in this issue of the magazine, we have an article by Dr. Shah. And, and the article, we normally try and do it, but it's not always successful. But today we have here with us Dr. Shah, who's written an article on gas and looked at responding to various questions on that. And so this is the article. You must take a look at it, and we will so this is the article on 5 ways to ease excessive gas. And so this is the article that we have, and we are delighted to have here with us Dr. Shah. Dr. Shah has been with us in the past. He's written for Seniors Today in the past. He's a leading consultant interventional gastroenterologist and is attached to the Breach Candy, Jaslok and Saifee Hospitals in Mumbai. He has vast experience in therapeutic endoscopy and metabolic correction endoscopy for weight loss. Delighted to have you with us, Dr. Shah. How has it been? We're always fortunate to have you with us on Health Live. How has been the health environment, in the last few weeks for you?
Yeah, thank you, Pradhiman, for having me again on Seniors Today. It's always been a pleasure coming here and talking to you, and getting all questions of all sorts and answering them for all the concerned citizens and our friends. Well, it has been tough. It's been a tough 1 year. All frontline workers are really working day and night. We've lost a few doctors, I would say quite a few doctors. So that, translates to a lot of loss of intellectual property, which is very sad, including teachers and all the other people. The important message one should take now is where everybody is telling wear mask, social distance, sanitize your hands, and now I will add vaccinate. Please, everybody, vaccinate yourselves. If you've got your first dose, go for the second dose. Don't run for it. Don't panic that you're not getting it. The vaccines are out. It'll all come. It's all being rolled out. Don't get nervous, but just go, just log on to the app. I'm sure everybody knows about it. Get your appointment and go and get the vaccine. It's as simple as that. It doesn't mean that if you go, you should take it the same day you go to the center. Does not mean that at all. But important is take your 2 jabs. The thing before we started this, Pradhyuman and I, we were talking when to take the jab, 4 weeks, 6 weeks, or 8 weeks. The studies have shown 8 to 12 weeks are good. Now the recent studies are showing 12 to 16 weeks. Please mind you, this virus is new. It's only 1 year old that we know. So we know as much as what you know. Probably we know it more in depth. So each week, probably the guidelines might change. It's not that, the government is inept or they don't know what's happening, but there are a lot of scientific brains behind this, combating this virus and this pandemic. So have trust, have faith. And the thing what I want to say is 8 weeks to 12 weeks is good enough. The recent guidelines is 12 to 16 weeks. So I think just keep following what everybody is saying, all the doctors, and you should be fine. That's very important.
Dr. Shah, tell me, supposing I have, and that's a fact that I have taken it after 5 weeks. So is there a reason to worry? Is there, what? And I'm sure there are various others because they've followed a different advisory who have taken it at 6 weeks.
When the second wave hit us, it spread like wildfire into the community. And because it spread like wildfire into the community, people were even advising to take the vaccine at 4 weeks. because now the studies have shown after the first jab and the second jab, what is the difference of the disease if you get COVID? How do they present? How severe or mild it is, or how bad it is? What is the mortality? And it has shown after 2 jabs, and if you get even the virus, the mortality is nil, very low to nil. The symptoms are mild, and the recovery is faster. So the stress was to taking the jabs. So I think when we were in that wildfire period, or when it had really gone to community spread, we all were advocating to take it a little earlier so that both the jabs are there, antibody titers go up, you're well protected. Now, things have become much calm. We can sense it in the hospital. Things have become better. There is no urgency. What was there. Fortunately, we never had that much of a shortage of oxygen. Beds were a shortage, but fortunately, I think overall Mumbai never had so much of an oxygen shortage. They were, but we fairly done well, and we fairly are turning over the curve, I would say now. So take the jab, and 4 or 5 weeks was earlier when the pandemic was raging, but now I think it is, you can go up to 8 weeks, 12 weeks and take the jab.
My question is that if I have taken the second jab after 5 weeks, is there any reason for me to worry that, well, I could, because the efficacy is not as good as it is meant to be, then I need to be careful, or is there something else that I need to do?
No, I don't think you need to worry about that. If you've taken, the jabs, even at 5 weeks, your antibody titers are going to go up, and one needs to check what we call as, spike protein antibodies. They are very important. They're the neutralizing antibodies to the virus. So that's about it. I don't think you need to worry. If you've got both the jabs done, you will have adequate antibodies. Antibodies titers above 20 are good.
So I'm going to ask you, the idea was, of course, not to get COVID-related questions, but there's one which has been asked, and I was reading a news report in one of the papers which said that there is a link between flatulence and the spread of COVID-19. And this is an article which is one of the mainline newspapers in the city. So is there any link at all? Flatulence and can that be a spreader?
No, especially with GI manifestations with COVID, people get acute pain abdomen, chronic pain abdomen. They can develop pancreatitis, other things. Flatulence, why do they develop, is because a lot of antibiotics are given, and antibiotics kill the good bacteria in the colon, and it produces a lot of it produces a lot of gas. Once the good bacteria is gone, that's the only link I can take between COVID and flatulence. If you're infected with COVID and you do pass a lot of wind, you're not a spreader. It does not spread through air or flatulence. No.
All right. Thank you. Let's get to the questions directly. So we have a question from Mr. CP Tyagi, who says, I'm 62-year-old of good health, except for one major issue of gas. Gas comes out with noise at the morning, immediately when I get up, and also in the afternoon when I get up from sleeping for 1 hour. May I get advice of treatment to get the issue resolved?
Okay, so there flatulence, gas, farting, it is all known. Now, these are what are the causes? I think let's discuss what are the causes of excess gas. One is we swallow a lot of air while drinking water or while eating. These are common things, okay, which we never really think about. We can swallow a lot of air. Now that air can produce a lot of gas, can trap a lot of air, and that causes flatulence, which you either burp out or you pass from down. When you eat fast, what happens is you're swallowing air, and undigested or uncrushed food goes into the colon, and the bacteria ferments this. I've written it in my article also, and therefore nitrous gas is formed, and that methane, that is the one which gives a bad foul smell. So drink slowly, chew food properly, and eat slowly. These are the preventive measures of getting gas. Second, we drink a lot of carbonated drinks. Third, if you have some disease like diabetes or thyroid, what happens is the motility becomes very slow. And so therefore the gas formation can become much more in these people because it does not go out because of the motility being very slow. Certain other things like lactose, people can be lactose intolerant, milk intolerant, and can produce a lot of gas. So one has to be aware whether they are forming a lot of gas after milk. Avoid the milk, probably the gas might be less. Celiac disease. Then there is another condition called a small intestinal bacterial overgrowth, what we call as SIBO. So these are all the common uh, things where we see a lot of gas. Other things are your fruits and vegetables. If you have a lot of pulses and dals, rajma, cauliflower, cabbage, sprouts, broccoli, these all produce gas. So again, food is one thing you have to be careful of. So these are all the common causes of having a lot of gas in the body. Now coming specifically to yours, what can happen is we sometimes can suffer from obstructive sleep apnea called OSA, and there's a lot of mouth breathing which is involved. Once there is a lot of mouth breathing involved, you're ingesting a lot of air, and therefore in the morning when you get up, you're releasing all that air which you have ingested over the over the 6 or 7 hours of your sleep. That's one of the commonest causes of a lot of burps in the morning or passing of wind at night.
Right, thank you. We have a question from Mr. Vijay Patwa. Says, my wife, 59, has frequently got problems of acidity and gas. The doctor has suggested to take a sonography, which shows there are a lot of stones in the gallbladder. And the doctor has advised to remove the gallbladder so that the problem of acidity and gas can disappear. Accordingly, the gallbladder was removed about 4 years back, but the gas problem continues to be there. So please advise.
Yeah, so there is a common linkage between gallbladder stones, gallbladder, and gas. But the point is, if there are stones in the gallbladder, 80% of our population will have gallbladder stones. You need not remove the gallbladder unless and until you have fever, you have jaundice, you have pain, and there is a rim of fluid around the gallbladder, what we call as pericholecystic fluid. Then and only one should remove the gallbladder. You can develop a lot of gas following removal of the gallbladder, primarily because what can happen is your digestion becomes very weak. If you have a lot of fat in your diet, then you can develop fat indigestion, which can produce gas. So therefore, following a gallbladder surgery, we advocate at least 6 to 12 weeks of a fat-free diet. Then your gas problem can definitely be solved. Regarding his wife, I think one has to look at what is her diet and what food is she eating. That's important. And a regular exercise she needs to do. If she's diabetic or hypothyroid, she has to check those levels and correct those levels.
Right. Thank you. We have a question from Mr. Sriram Iyengar from Bangalore. He says, I'm 71 and a chronic constipated person. Gas between gaps make the bowel movement very difficult. Drinking warm water or hot milk makes no difference. Please suggest a remedy.
So chronic constipation is one of the common things which, yes, they can produce a lot of gas, in the sense that because there's nothing coming out, there's a lot of gas which gets accumulated in the colon. We need to solve your chronic constipation problem. Now, what is the cause of your chronic constipation? Do you have diabetes? Do you have a thyroid problem? Are you taking any antidepressants which can reduce the motility of the colon? These are important causes one has to know. We have to investigate why you're getting chronic constipation. Then there are medications which can relieve you of chronic constipation. And once you take those medicines which can relieve you of chronic constipation, probably your gas can also come down.
Right. Thank you. We have a question from CP Panchal, who's from Targar in Navi Mumbai. He says, I'm 67 and a diabetic. I want to ask the doctor that I feel heaviness post dinner. Irrespective of what I eat, I get that discomfort post dinner. I try to switch to fruits and juices, but the problem persists. During the daytime, I do not have such kind of problems.
So the thing is, probably it's your diet which you're having in the night. So you need to see your diet. What specific are you eating in the night which can produce this? This is classic of a diabetic called as postprandial fullness. That means after eating food, you develop a fullness in the stomach. There are certain medicines which can relieve that. You can ask your physician. I'm sure he will know it, or you can ask your gastroenterologist there. He might be able to suggest you that medicine. It's called ecoshiamide. Uh, but we need to investigate again. If there is no other problem, then only we can give you these certain medicines. But what you have is a very classical, what we call as a postprandial fullness. So have a look at your diet and get your diabetes well under control, and hopefully this should become less. Very interestingly, Pradyuman, let me tell you that the colon and the intestines, they all have around 100 to 125 ml of gas every day. It's always there. On an average, you'll be surprised to know, Pradyuman, that we pass wind 14 to 23 times per day. In men, it is more. In women, it is less. So passing gas, so much of gas is definitely is okay. In fact, the Hippocrates had actually said, the flatuosities. The flatuosities means the passing of gas is necessary for well-being. The Chinese had actually said that after you burp, they said that it was an appreciation of the meal. So the burping was necessary. Way back in the Roman Empire, because I was reading a bit about the gas and all, so I remembered this, so I should share it with you. The Roman Empire had actually banned people from passing gas in public, which was then later overturned much later. So there's very interesting, history about gas, which has kind of come around. So this is a bit of the history about gas. A foul-smelling gas is, I've told you, it is methane. It is bad bacteria. We need to change the bacteria. So if there is any question, I'm sure there'll be questions about good diet and good bacteria. Then I can tell you on
Right.
what one needs to do. But this was a bit about gas, which I thought was an interesting history
Yeah,
about gas, which I had read.
very interesting. We have a question from Mr. Gurdeep Singh Sraw, who's one of our regular viewers. He has three questions. The first is, does eating something sweet after a meal add to the gas problem? If yes, what is the appropriate way or time to have the sweet item?
So sweet, like you have fructose or sorbitol, they all produce gas. All right. So it is important that what you need to do is um, you need to actually stop it. There's no specific timing. Like if I have it in the morning, I'm not going to produce it or not. So, but if you really want to have it in the morning, because in the night it can be very discomforting. It can wake you up from your sleep and cause other, sleeping pattern problems, and that can, aggravate what we call as an IBS, and that's a whole nother discussion. Ideally, you can have it in the morning. Avoid having sweets in the night. That's the first thing I can say. We know lactose intolerance, carbonated drinks, fructose, sorbitol, these all can produce a lot of gas. So you need to actually avoid them. That's the first thing.
Avoid sweets in with dinner.
Yeah,
That's a huge ask, especially in an Indian scenario.
absolutely. It is very difficult to convince people, but you can tell them you can have the sweet in the afternoon, which is fine, because it's it's purely to satiate the mind than anything else.
All right. The second question is, why do I have acidity and or gas if I eat jaggery or that is gur or saunf after a meal?
Don't know the specific reason, but you might be having what you call as an irritable bowel syndrome. That's where your motility could be a problem, and therefore you're just producing a lot of gas. I mean, that's about it. Jaggery is good in iron, so it's good to have it. And soft people actually take it, it acts like a coolant in the stomach. So both are actually good. Probably you're swallowing too much of air while eating. I don't know. So eat slowly, chew properly. Hopefully that should not occur.
Right. And the last question, again, an interesting question, which I'm asking three from him, is why is it that as I've aged, I have got allergic to papaya, bananas, and custard? Anything that can be done to reverse this? He is 64.
Yeah, so allergies can come at any given point of time. You're probably allergic to it now. Take away all of them from your diet for minimum 6 months to 1 year, and then slowly introduce one by one, at a gap of almost 4 to 6 weeks, and then see how you respond to it. So it's purely part and parcel of an allergy which you've developed in the old age. That's about it, nothing else.
Right. Thanks. We have a question from some in the chat window. Mr. KV Shah, he is a male, 71. He has a gastric problem despite an hour of walking every day. He does 15 minutes of yoga, pure veg, no smoking and drinking, and 10 glasses of water. Wakes up at 4:30 in the morning and sleeps at 9:30.
Yeah, so Mr. Shah, you've not told me whether you're diabetic, hypertensive, whether you're hypothyroidism. What do you do? It's you're fairly well balanced lifestyle. 10 glasses of water. You must be swallowing a lot of air with the water. So one thing I can tell you, when you're having water, you can have it with a straw, because once you have it with a straw, there's a lot of air which you are swallowing goes away. It gets negated. So you can do that and see whether that helps you or not. I don't know your diabetic status, because if you have diabetes, it can be a problem. So that's all I can say.
I guess he will ask us a question again. He's online right now. We have another question from Mr. Nagbhushan in Bangalore. He says, I'm 73. I have a bad bowel movement and gas, not getting cleared in the morning, even after consuming a lot of fiber and doing regular exercises. I have no BP or diabetes. Please suggest a solution.
So basically, you need to have a good laxative. Now, a laxative can be there are many forms of laxatives, but the natural laxative is Esop Goal. So you can try Esop Goal, and hopefully your problem should get solved. Plus, have some curds morning and evening, which is again a good natural probiotic, because bad bacteria which can go from your body is by having antibiotics, and we all are so commonly used to having antibiotics or popping in antibiotics, or our gps just give us antibiotics because that's the quick fix. Now these bacteria, these antibiotics, they kill the good bacteria, and that gets replaced by bad bacteria which produces colonic inflammation, gas, and other problems. So I would say that, have good bacteria in the natural form, have Esop Goal. There are preparations of Esop Goal with a mild laxative dose also. So a compound, a laxative compound. So there's a combination of Esop Goal with a laxative compound, so that can produce soft pasty stools and regularize your bowels. You can definitely do that.
A lot of people have Esop Goal as just fiber in a typical diet.
Yes.
Is that something that is recommended?
That is recommended. That is beyond 50, we all can take Esop Goal at night just to regularize our bowels. It's a very good natural laxative.
And
Or a
Esop Goal
softener.
Esop Goal with water.
Esop Goal with water, Esop Goal with dahi, chash. You can put it in your food and eat it also. So it's very, very easy to use.
Thank you. We have a question from Mulki Narendra Karupurwa, who says, I have been a patient of acidity for some time, and I have been prescribed to take Refron 20 daily, 1 tablet before breakfast. This has given a lot of relief, but I have been taking it in the last 18 months. Will this have any implications if it is continued?
So I think with these medications, you should also take some probiotic. That is important. There are many preparations which are available in the market. So start yourself on a probiotic, take that in the night, and that should be fine. The acidity is again a part and parcel of irritable bowel syndrome. I really don't know the history. So whether you are put on a PPI with a prokinetic or not, you need a probiotic or not, a stool softener or not. But if you are taking whatever medicines I've said, just add a probiotic and that should be fine. Do regular exercise and eat small portions of meals. That's very important. You should eat small portions of meal, but eat frequently, eat slowly. Very important. Chew your food. All right. Because the teeth are the grinder. The stomach is a mixer. The intestine is an absorber and the colon is an excretor. So they are very specific functions of the human body. Now don't expect the colon to grind your food. No, it's not going to happen. So better you grind your food properly so that it gets broken down in the stomach properly with acids and all, and gets absorbed in the intestines properly, and then gets excreted out. So the body is very particular with its function. So you cannot make one and two function otherwise.
So we have a very long question from someone, but he is Mr. S.P. Bora, and he is 95. He has a gas problem persisting for the last 1 year. When pressure builds up, I have to rush to the toilet, but instead of passing stool, only gas gets released. It is only after 3 or 4 visits that the stool passes, and that too is hard. In bracket, he is written constipation. I have a lot of burping and belching. This results in sleepless nights with shortness of breath, pain in joints, and general weakness. I have tried all pathies, allopathy, homeopathy, naturopathy, and Ayurvedic, but without any relief. One gastroenterologist, and he specified outside Mumbai, advised endoscopy, which I am hesitating to get done, perhaps because of its invasive characteristics. He has no diabetes, no blood pressure, his uric acid level is on the higher side, and cannot walk for more than 10 minutes at a stretch. He's had a heart bypass 10 years back, which is when he was 85. I realize that nothing much can be done with old age related diseases, but I should consider myself fortunate if I get some relief in joint pains and undisturbed sleep. So this is his question.
I would like to know that, is he also taking any blood thinners like Ecosprin or something, which is important because these medicines can cause a lot of acidity. Blood thinners or medicines which can alleviate pain, like you're using brufen, ibuprofen, combiflam, diclofenac sodium. These are all medicines which can produce a lot of acidity and can cause a lot of GI upsets. Particularly for this gentleman, I would recommend him a double dose of PPI with a prokinetic and a good stool softener. And the other good medicine which we have for gas is simethicone. He can try simethicone 3 times a day, and hopefully he should feel better. The other thing which I've not really spoken about, Pradyuman, is that we can have what we call small intestinal bacterial overgrowth called SIBO, where one can do a hydrogen breath test, or these are the tests which are available and can tell us whether you're having bacterial overgrowth or not. You can have a lactose breath test, a hydrogen breath test. They are being done in my clinic, both of them. So with that, we come to know, and for that, then the treatment is completely different. We give a medicine called rifaximin, which can be given for 14 to 21 days, and that completely takes away the gas.
For the benefit of our viewers here, Dr. Shah has been saying, advising a lot of treatments, etc. In case you've missed something, the video, the recording of this session will be on Seniors Today website on Monday morning. So in case you think you've missed it or you've not been able to write down, you can watch the recording of this program, as well as there will be an edited takeaways of whatever he said, but that will be edited. You can hear whatever he has said on Monday, so don't worry in case you've missed out on something. Thank you for that detailed thing, and Mr. Vora, delighted that you are with us today, and at 95, he's written a very fantastic long question and articulated himself so very well.
Pradyuman, can I just say about endoscopy? Right. Mr. Vora, endoscopy has changed a lot. There's been a sea change in endoscopy. So you should not get worried about it, because it's a completely painless procedure. It's an OPD procedure. It takes less time. There are good sedatives, which are short-acting sedatives, which can be given during the procedure. So you will have no pain. You have no recollection about the procedure. It can give you a lot of information, but it has to be what is the indication. And then one can think about doing an endoscopy or a colonoscopy. I think there's a big myth that, endoscopy, painful. Well, 20, 30 years back, things were different. Now the scopes are thinner. The technique has become better. The medicines which are available have become much better. And so therefore now it's a very seamless and a very safe procedure which one can do at whatever age. I'm also attached to Parsi General Hospital, and there we have a lot of geriatric age group patients. I have done endoscopies on 98 and even 100-year-old endoscopies and colonoscopies, and they've all done well. There's nothing to be worried about age or anything. It's a very safe procedure, let me tell you, but in the right clinical indication.
Thank you. We have a question from Kirti Hadar. It's actually a question from Jaggi from Kuwait. He says, the question is, I have every time I switch to a healthy diet to lose weight, I develop a lot of loose stools. But when I'm on a regular high fire diet, I don't suffer from this episode. Is this normal? Any recommendations?
So he says that with a high fiber diet, he's doing well, but with a low fiber diet, he has loose stools. That's what he says.
With a high fat diet.
High fat diet. So he's talking one of those fat diets which one people take for losing weight and all that. Well, I really cannot really comment on that because there've been so much of discussion on diets, on ketogenic diets, and all these diets. Well, it's subject to a person whether you lose weight or you don't lose weight. It all depends on your intestinal flora, because let me tell you, bacteria can, or the gut microbiome can also be a resultant for obesity. So therefore, we need to change the gut microbiota, and therefore you will, definitely lose weight by just changing a gut microbiota rather than changing your diet. It has to be done in a very graded it has to be done in a very graded manner. That's one. Let me tell you, a lot of high fat diets can also produce a lot of gas. All right, like potato starch, they all produce a lot of gas. So we tell them to actually avoid this. So that's the only thing which I can tell. I don't know whether I've solved Jaggi's problem or not, but whether he's diabetic, whether he's hypertensive, smoker, drinker, that's what is his weight. I would like to know, because he's on a diet. So I'm sure he must be either obese or overweight. I really don't know. So I need to know more details on that.
Right. We will of course have your email connects, etc. We will share it with people so they can reach out to you. Also, we have a question from Girdhar Kumar Rajan, who says, I'm 71. I have a problem with gut bacteria. The stool is of loose consistency. Any remedy?
So stool consistency being, consistency means it's becoming loose and then hard and loose, or it's alternating, or it's constantly loose. One needs to know about this. That is important. You have what we call as a irritable bowel syndrome, whether it's a constipating or a diarrheating variety. Very very difficult to say. So you will need some workup, because it is very important that if you're having loose consistency. Let me tell you, in elderly age group, if you have an altered bowel habit with weight loss or with blood in your stools, you immediately need to get investigated, because that can be a very early sign of a cancer or a cancer being formed. So that's very important.
Right. Thank you. We have, I'll leave the diet questions to later. We have a question from someone, an anonymous attendee, who says that my husband is very habituated to having Gelusil every night. Earlier, he would have Unionzyme and he would have Tums. Now, how do I get him out of this habit? And are these harmful?
No, they're not harmful. Gelusil, Tums, and all these are not harmful. What you can do is you can switch them over to Simethicone and start with a low dose of a proton pump inhibitor, like 20 milligrams once a day before food or before breakfast, and that should be fine. Make sure that his diet is good. He's having adequate exercise for the day. That should be good.
Right. We have a question from Mahalingam, who asks, for a better digestive system, there's a view that fruit should not be had after dinner. Is there any right time for taking fruits? And the second question person has is drinking water after food not good for the digestive system?
But there are a lot of myths when to take fruits, before, after. Dietitians will tell you, nutritionists will tell you. There's actually no real study which can tell us when is the good timing to take it, or even about water. Probably people say don't have water after, it leads to poor digestion and all. Bottom line is 8 to 10 glasses per day is important. All right. And fruits, ideally take it before your food. That would be the most useful. because certain fruits you might not be tolerating, like citrus fruits, like oranges or pineapples. They can produce a lot of acidity. So if you have it before food, the food which you consume will consume all that acid and have a better digestion. That's the very simplistic way one can say, or rather than having it after food. Whatever fruits you have, make sure that you have it in moderation and not just too many. Some people only prefer having fruits for their lunches or for their dinners. Yes, you can have them. Avoid citrus fruits mainly. So that should be good enough. And your fruit should have like banana and papaya, which will have good potassium, papaya, which are good stool softeners. So these are all good. Apples are constipating. So please remember that the apples can be constipated. Then you have oranges, you have lemons, you have grapes, which can be acidic. So take care and have a good balanced fruit bowl. That's all I can say.
Yeah, so we have a question from Malcolm Montero, who says, I have fruits for breakfast and then follow it up immediately with egg and toast. Do I need to maintain a gap between the fruit and the egg toast? And if yes, how long should it be?
Well, that's very subjective. There's no really scientific data to tell that when can one take, after your breakfast, have your fruits. I think you can take it, immediately after that, or you can give it a gap. Uh, People sometimes feel too full immediately after consuming food, so they give themselves a little bit of a break to just quieten the stomach down, and then you can have your fruits. I would say, logically speaking, I'm not giving you any scientific data. You can wait for 10 to 15 minutes and then have your fruits.
And since this is the season, we have a question from Narendra Acharya. What is the correct way of eating mango? Empty stomach, morning, evening, or with milk or food?
Just have mangoes however you want it, because it's a very seasonal fruit. I tell all my patients, you want to binge now. Forget about how you want to take it. Just eat as many as you want. But important is, mangoes can produce a lot of acidity. They can produce even loose motions. So go easy on your mangoes. They are good. They give you good amount of vitamins. All right. So you can have mangoes cut, or you can have them in a juice form, or you can have them, what we typical Gujaratis, we have ras rotli. You can have ras. There is absolutely no problem. You can go ahead, and it's only for 1 or 2 months, and then after that, mangoes are gone. So just
You
go
seem
ahead
to, you
and
seem to
enjoy
be
them.
enjoying your mangoes, is it?
Sorry.
You seem to be enjoying your mango.
Oh, yes, guilty as proven. I do enjoy my mangoes.
Yeah. So we have a question from Malcolm Montero has another question. Can having raw foods like salads be combined with cooked foods, or will it contribute to gas? You have answered a question. You have said something about some kind of foods, vegetables. So this
Yeah.
is,
So important, salads can produce a lot of gas, because a lot of people have cabbage, cauliflower, they have sprouts, they have all this in their diet, and these are known to produce a lot of gas. Now, what happens is, when you're having salads, we chew, but we're not really chewing them into shreds. All right. So there are a lot of pieces of salad which go into the stomach, which go undigested, and they can ferment a lot of gas. So, and there are some subset of patients who do beautifully with salads. So if you're one person who's having salads and having gas, that means you have a propensity of doing this. Chew it properly, make the salads into really small pieces, and then have them. Probably that will solve your problem. But yes, it is known, sprouts, asparagus, cabbage, cauliflower, pulses, dals, rajmas, they all produce gas.
we have a question from Ajit Menon, who asks for your opinion on intermittent fasting to reduce hypertension, CKD, and diabetes.
Intermittent fasting is shown to be good if you are fasting between 12 to 16 hours, because that, it brings down your weight. Once your weight goes down, your diabetes, blood pressure, thyroid, everything comes around. There are various types of intermittent fasting, but I would advise 12 hours or to 16 hours of intermittent fasting if one really wants to lose weight. You will cardio metabolically get fitter by doing 16 hours of intermittent fasting.
Right. We have a couple of more questions which I'll ask. One is from Mahavir Krishnaji Hazare, who asks, sometimes after food in the afternoon, I have to go for loose motions. After loose motions, once or twice, I feel okay and normal. His age is 66 and taking medicine for diabetes and blood pressure.
So there are certain diabetic medicines which can also produce loose motions. So one has to be careful. If you're passing 2 to 3 stools per day, it is okay. Don't worry about it. It's not loose motions. There's a lot of myth. People say I have loose motions, and when I ask them, they're passing only one per day. People say I'm constipated, and they say I'm passing 3 times a day. So there's a lot of variation amongst people who know the right terminologies. Loose motions is passing 4 to 5 loose stools of variable quantities per day. Okay, that is counted as loose motions. Constipation, you have one spontaneous bowel movements once in 2 to 3 days is constipation, not otherwise. If you pass 2 to 3 times per day, whatever it may be, whatever consistency it might be semi-solid, solid, hard. It is important that you should be passing good stools. The liquidy stools, it can purely depend upon what medication you've taken, what diet you've taken, or what's happening. There is something called as a gastrocolic reflex, which can happen. Once you eat, people go and pass stools. It can be after breakfast, lunch, and dinner, so people can pass three. I think that's fair. It's a known entity. Uh, One can look out for an infective colitis in these people, and once that infection goes around, hopefully the gastrocolic reflex can also settle down.
We have a question from Mr. Raghavendra Odiar, who says, is it normal to have a bowel movement 2-3 times a day? He is aged 74.
I've told you it is normal, but if your stool is having blood, or if your stool pattern has changed with loss of appetite or loss of weight, please get investigated, because at this age we can develop CA colon or CA cancer, cancer of the colon. We initially thought that, cancer of the colon is not much in our country because we eat a lot of vegetables, we have antioxidants in our diet. But in the last 15 to 20 years, I think all our diets have changed. There's a lot of fat food and fast foods which have come in, and therefore we are seeing an increasing trend of cancer of the colon. So through this medium, I would like to say that please get your colons investigated, do like a screening colonoscopy. Very important, because you will find polyps, and these polyps can become cancerous later.
And how often should one get these investigated?
So the guidelines is at 50, get a colonoscopy done. If normal, straight at 60, then 65. Now, if you find a polyp, depending on the type of the polyp, the screening does come around. After 60, if you do it, you can do it every 3 years.
Right. We have one question which is from Mr. Mukherjee, and it is about wheat. And there was one more question on this. He says, my wife buys separately jawar, bajra, ragi, oats, gram, etc., and mixes 50% of these and adds 50% of wheat atta to make a multi-grain atta for chapati. My question is, what percentage of mix of millets and pulses would you recommend to make atta for chapati for easy digestion?
I don't think I can give you a composition of that. It's very good at nutritional or dietitian, but I can tell you wheat, celiac, be aware. So don't mix your wheat with all these bajras and all these things, because that is a completely separate diet. This is a completely separate diet. Wheat, celiac disease can produce loose motions and can affect your health. So be aware of that. That's all I can tell you.
Doctor, there's been somebody who's asked whether they can consult you, teleconsult you, etc. So is there a place that they can, at your clinic?
Yeah, they can call my clinic, or my mobile number is there on Google. It's Ayush GI Care. It's at Gamdevi. So you can either give them the number, or and I'm doing teleconsultations at this moment because of COVID, and people want to physically come, they can come to the clinic. It's from Monday to Friday from 3 o'clock to 6 o'clock.
Monday to Friday, 3 to 6 p.m.
Yeah.
And they can visit your website.
Yeah. Or they can call up this number 2367-6598.
1 second. 02223
67
7
6598
6598.
/83. So there are two numbers.
Great.
And-
I have put this number on the chat, so those of you who are interested can
Yeah, they can call up the clinic. They'll give them an appointment for virtual consultation, and then we can do that. There is no problem in that.
Thank you so much, Dr. Shah, for taking your time out today. As always, there are several questions, and I think you've been able to address most of them. And thank you once again for writing that article in Seniors Today magazine. We will, as always, have, as I mentioned earlier, a recording of this session on the Seniors Today website. That it will be there on the homepage. But if you want to look at our archives and also watch the earlier times Dr. Shah was there, you can see it at seniorstoday.in/webinar. Thank you once again, Dr. Shah, for being here. And we will be back with yet another session of Health Live at Seniors Today. Do not forget to read the magazine, which is at the Seniors Today website, which has an article by Dr. Shah and several other features which make this issue truly unputdownable. Thank you once again.
Thank you, Pradyuman. Always a pleasure talking to you and being here. It's really very nice, interactive. We also learn quite a few from our patients of the questions, and it keeps our mind ticking. So thank you a lot.